Hello friends, so how do you approach the content and the new timetable that we have started? So first in the Medsynapse app you have this paid courses and there you have this short course. So in the short course you have this short plus extra edge folder and the November 25 short folder. So for any subject, your first target is to finish off short and extra edge because these covers the core topics that are like must know and frequently repeated for any subject, and they're covered in a very easy way with easy tricks to remember. The videos follow the short videos follow the magic book content, which is 5.0 or 6.0. The content is the same in magic book 5.0 and 6.0. Just at the magic book 6.0, the font is bigger, the images are clear, and there is more space. So whether you should be watching the short from this folder or short from this folder will be decided basis if you have seen the short before from any of these folders. Stick to it. If you are starting afresh and you are using Magic Book 6.0, then you should go for this November 25 short folder and complete the short videos from there. Learn short very thoroughly. Then comes the extra edge. Now the extra edge videos basically cover the topics that are previous year topics and they have not been covered in short. So again, it's a must do, and that too very thoroughly. So the extra edge videos need to be accessed from this folder. So once you go here, you will see that this is anatomy 1 short, this is anatomy 2 short, and this one here is extra edge and extra edge. So the video which is extra edge will be labeled here. This is extra edge. So like you see for physiology as well, this is extra edge and extra edge. So these are the extra edge videos which are there for every subject. Now some videos you would see that they have short plus extra edge content together. So like you see here, this video has short plus extra edge is what we have started here. So in such videos, you will be having a timestamp which is there, which tells you that where the extra edge is starting. So for example, I put this timestamp that this is where the extra edge is starting. So you can directly jump to the extra edge from this timestamp. So for subjects like ENT, Ophthal, Dermatology, which have short and extra edge together, so you would see here the short subjects at the end. So like this has extra edge here, this has extra edge here. So for these videos, I've added the timestamp which tells you that this is where the extra edge starts. So you should be covering the extra edge from this folder. Now, do we have a hard copy for the extra edge topics? No. We do have the PDF attached to every video, which is PDF 1 and 2. One is annotated, one is blank, and you can export, that is download and export these PDFs to your device. If you're using iPad, tablet, you can make the notes in that. If you want, you can take the printout. If not, in this folder which is there, which is the PDF folder, right, this PYT Magic Book PDF wala folder, here I have this extra edge short compiled all subjects PDF which I've given together, which is approximately 400 pages. So you can see this is like all the subjects extra edge that has been combined. So if you want, you can take a printout of this. If you are not using the soft copy, the digital notes making, you can take a printout of this for the extra edge content. So this is how you will do for the extra edge. Now coming to the RR that I have mentioned in the timetable, it is the RR rapid revision from your primary resource, whichever resource you are using. So after completing the short and extra edge, you'll be moving on to the rapid revision. And before that, yes, we have the TNDs also. So this is the folder which has the previous year questions, the TNDs in the past that we have done. This is the most recent TND that we have done. So the PYQ TNDs, so here you will go to this folder, there is subject wise test. In the subject wise test, so for example, you go to anatomy. In the each subject, I've mentioned that this is PYQ, this is PYQ, this is PYQ TND. This is what you have to finish first. So again, for every test, you have the PDF attached, which will have the blank and annotated. You have this attempt test option. So before going to the video, attempt the test quickly and assess your preparation, and then start making notes for whatever you're learning from the TNDs. So this you would see for every subject. This is PYQ wala TND. So this is what you have to finish, where I've mentioned that PYQ TND needs to be done first. Same as for all the subjects as well. Attempt the test before looking at watching the video. So that was about the TNDs and the RR from your primary resource. And then at the end, complete all the PYQs from your primary resource, again the Q bank that you are using. And PYQ custom modules that I've mentioned basically is do the PYQs topic wise. So for example, in anatomy, make custom module of embryology, PYQs, the tags of NEET PG, AIMS, FMG, and do all embryology questions together, the PYQs together. And wherever you are making mistake, you had forgotten, you think that it's volatile, make notes of it and keep revising that on a daily basis. So that is what we mean by PYQ custom modules. And it's not hard and fast that you give these many days only for any subject. So for example, if you're done with short early on day 1, you can start with extra edge. You can start with the rapid revision. If I've given 2 days for bigger subject, you can do it over 3 days by managing your time, completing the TNDs the previous day earlier so that you can start the rapid revision 1 day early as well. So this is a good enough timetable which gives you enough time to complete the topics. And then regarding the surplus topics, like in the subject video surplus, you don't have to watch anything else in the subject videos, but then you have this the surplus topics which are there. This is the list of the topics which are covered, the videos which are covered topic wise. So lymphatic drainage, cadaveric images, internal capsule, spinal cord tracts, right? So these need to be watched separately, not all of them, because many of them have been covered in the short and extra edge. So for example, the Brodmann areas has been covered, mesonephric, paramesonephric has been covered. So only the extra topics, I'll try and give you the target for the day for the surplus topics to be watched daily, so that side by side you can complete the surplus as well. So I hope this makes it clear that how to approach your syllabus and the content integrating Medsynapse with primary resource. Thank you, and together in this.